If your loved one is starting the journey to recovery by taking Suboxone, you might have some questions. Even more importantly, you may be wondering how you're going to be supporting them during this time. You might not feel you can be supportive all the time because you're overwhelmed with emotions, while helping them get the help they need to recover. You could have some mixed emotions, and you might not be sure it's the best choice. It's normal for you to have doubts with treatment that don't make sense to you. Addiction is a disease, so taking Suboxone for addiction is like taking medication for any other disease. Your spouse, sibling, child, or other loved one who has affliction will still be clean and sober when they're taking Suboxone. Doing some thorough research on Suboxone could make you feel more comfortable to know your loved one is being treated with something that really works. If you're questioning the effects of Suboxone, read the following information about what is the best choice in treating opioid addiction. When someone takes Suboxone during their detox, they will not feel high. Suboxone is a partial agonist, which means it's just as strong as any agonist drugs like heroin, morphine, or fentanyl. Suboxone tricks the brain into thinking it's receiving opioids the body has become used to, and stops the withdrawal symptoms. For those who decide to take their Suboxone treatment at home, they will have to see a doctor who will perform the thorough examination. The physician will ask several related questions concerning their health to make sure Suboxone is right for them. Everyone's body is different, so your loved one might not be a good fit for this type of treatment. If they do get prescribed Suboxone, they must be experiencing withdrawal symptoms before they even start the medication. According to the National Alliance of Advocates for Buprenorphine Treatment, taking naloxone, which is one of the key ingredients of Suboxone, before the start of detox, it's so important to wait the amount of time the doctor recommends to avoid this. The amount of time depends on the type of opioid your loved one has been abusing. Just remember, Suboxone, like any other medication, should be taken previously as prescribed by the doctor. Make sure you remind your loved one that taking more than the prescribed amount will not make them feel any better or any faster, because that's not how this medicine works. On the second day of medication, they will most likely be able to return to work. Even so, it's important to remember that this is a disease that will not go away or be cured with one Suboxone treatment. By continuing their counseling sessions, your loved one can maintain the sobriety and still live a normal life with you. A therapist, which they should see in conjunction with their Suboxone program, can also assist them in figuring out when they can begin to taper off the medication. 12-step meetings can help them get the further support from those they can connect with and others who are going through similar situations. When it comes to the way you feel about things, it might be hard to keep your judgment and opinions to yourself. You can seek meetings on your own therapy sessions to help you get through your own emotions and feelings on the matter. These are both ways you can express your anger, pain, and impatience that you might feel more comfortable communicating with people who can relate to your side. This can enable you to remain healthy and supportive of your loved ones. If you can, you should encourage your loved one to share their experiences so you can be a shoulder for them to lean on. It's essential to stay supportive through the recovery process. Your loved one might be the most powerful motivation for them to stick with the program and remain sober. If they've been struggling with their addiction for quite some time, they may have made choices and mistakes that they're not proud of. It's important to let your loved one know how much you care and working towards their overall forgiveness during this time. If your loved one has sought out Suboxone treatment, then it means one thing for sure, that they want to get better. We hope you found this video informative. If you're seeking Suboxone treatment for a loved one, please browse through our directory or give us a call at 1-888-501-2143. On behalf of Find Suboxone Near Me, thank you for watching.